Hello everyone, welcome to dental subjects. We are already discussing the facial muscles, right? Okay, let's discuss the remaining facial muscles. Okay, first one is the buccinator muscle. Buccinator muscle is the cheek muscle. It is a flat, square shaped muscle. It forms the side wall of our mouth. Okay, it mainly aids in mastication, that is chewing, and other actions like blowing and sucking actions of the mouth. Okay, it is found deeply inside the flesh of the cheek and the other facial muscles. Buccinator is pierced by the parotid duct and the mandibular nerve. Okay, it gets its origin from the alveolar process of maxilla and mandible, and also from the pterygomandibular raphe. Okay, its insertion is in the upper and lower lips. That is in the orbicularis oris muscle. It is present around the lips. Okay, its main action is the compression of the cheek. It keeps the food between the teeth during chewing. That is, it flattens the cheek against the gum. So, it prevents the accumulation of food in the vestibule. Okay, this is commonly known as the whistling muscle. Okay, it aids in blowing, whistling, and sucking actions. Okay, it gets its nerve supply from the facial nerve and blood supply from the superior and inferior arteries. Okay, superior and inferior labial arteries. Okay, its main clinical significance is any paralysis or weakness in the muscle leads to the inexpression of the facial muscles. It is commonly affected in a Bell's palsy condition. Okay. Next one is the zygomaticus major. Okay, it is present in the cheek. Okay, it gets its origin from the zygomatic bone. Okay, as the name indicates, it's the muscle present in the side of the face, and it gets origin from the outer surface of the zygomatic bone. Okay, it gets inserted into the angle of the mouth. Okay, its main action is to it elevates and draws the angle of the mouth up and laterally, producing the smiling expression. We already seen that one of the smiling muscle, right? Levator anguli oris. Okay, like that, it also elevates and draws the angle of the mouth and produces a smiling expression. Okay, it gets its nerve supply from the facial nerve and blood supply from the facial artery. Okay, any paralysis or weakness of this muscle, especially in the facial nerve palsy, leads to inability to elevate the angle of the mouth, resulting in the decreased expression and drooping of the mouth. Okay, one is the zygomaticus minor. It is also present in a sick child near the zygomaticus major. Okay, it also gets its origin from the zygomatic bone just inferior and medial to the zygomaticus major. Okay, see the diagram. It is inserted into the upper lip and the medial angle of the mouth. Okay, it also elevates the upper lip and deepens the nasolabial fold. Okay, in the lateral part of the nose. Okay, it gets its nerve supply from the facial nerve, especially from the buccal branch, and blood supply from the facial artery. Okay, it also has the same clinical significance. Any paralysis or weakness leads to the loss of nasolabial fold and a decreased facial expression. Okay, next one is the orbicularis oris muscle. Okay, it is the muscle which is famously known as the kissing muscle. Okay, it is the complex circular muscle surrounding the mouth. It forms the majority of the lips. Okay, it also controls the lip movements. Okay, it gets its origin from the maxilla and mandible medial to the modules. Modules is nothing but it is the present in the angle of the mouth. Okay, it gets inserted into the skin and mucous membrane of the lips. Okay, its actions are it closes the lips, it pursues the lips as in whistling, it protrudes the lips as in kissing, and it compresses the lips against the teeth and gums. Okay, it gets its nerve supply from the facial nerve and blood supply from the superior and inferior labial arteries. Okay, any paralysis or weakness of this muscle leads to the reduced lip movements. Next one is the depressor anguli oris muscle. It is a small triangle shaped facial muscle. Okay, it is present on either side of the chin. Okay, it gets its origin from the oblique line of the mandible just below the mental foramen. Okay, and gets inserted into the angle of the mouth. Okay, its main actions are it depresses the angle of the mouth and produces a frowning or sad expression. Okay, do you remember that? The levator anguli oris produces a smiling expression. The depressor anguli oris produces a sad expression. Remember? Yes. Next, it gets its nerve supply from the facial nerve and blood supply from the facial artery. Okay. Any weakness or paralysis of this muscle leads to inability to depress the angle of the mouth, resulting in the reduced facial expression. Okay, the depressor labii inferioris. Okay, it is a muscle which is also present in the chin area near the depressor anguli oris muscle. Okay, it also gets its origin from the oblique of the mandible, lateral to the mental protuberance. Okay, it gets inserted into the muscles of the lower lip. Okay, its main functions are it depresses and everts the lower lip. Okay, and also it deepens the labiomental groove. Okay, it gets its nerve supply from the facial nerve, especially from the marginal mandibular branch, and blood supply from the inferior labial artery. Okay, any paralysis or weakness of this muscle leads to inability in depressing the lower lip. That is, that results in reduced facial expression, especially the sad expressions. Okay. Next, finally, the mentalis muscle. Okay, mentalis muscle is present in the chin area of the face. Okay, it gets its origin from the incisive fossa of the mandible. Incisive fossa is a depression below the incisor teeth, right? Yes, below the roots of the lower incisors and gets inserted into the chin. Okay, its main function is it elevates and protrudes the lower lip. Okay, and wrinkles the skin of the chin. Okay, these are the main functions of the mentalis muscle. It gets its nerve supply from the facial nerve and blood supply from the inferior labial artery. Okay, any paralysis or weakness of this muscle leads to inability to elevate or protrude the lower lip. That is, it results in decreased facial expression, especially the sad expression and wrinkling of the chin. Okay, this is the end of our class. If you have any doubts, please kindly share it in the comment section. Thank you.